Acute versus chronic pain. What is the difference and what's the treatment for each? Here with more is Dr. Reiner Kremer from AZ Pain Centers. It's good to see you.
Thank you very much. Appreciate the opportunity to be here.
Absolutely. What is the difference between acute and chronic?
Acute pain is defined as pain that is 4 to 6 weeks or less.
Okay.
So it's something that usually occurs suddenly, caused by infection, injury, or illness, and it causes tissue inflammation. Most of the time, pain goes away within a matter of days or weeks.
Okay, so I'm assuming chronic is the one that doesn't go away?
Doesn't go away. What happens there is pain kind of hangs on. It may kind of wax and wane, and it often lingers for months and can go on for years, and is defined. Pain over 90 days is typically defined as chronic pain.
And is the treatment different for acute pain versus chronic pain?
Absolutely. Acute pain generally will use rest, ice, compression, elevation. You can use some over-the-counter anti-inflammatory, sometimes bed rest. That will help heal the particular injury, or if there's an illness and the patient recovers. With chronic pain, what we see, because we treat primarily more musculoskeletal injuries and joint-related issues, those acute problems that are not treated effectively or efficiently right out of the gate wind up becoming chronic, because pain is a signal of tissue damage. And that usually leaves inflammation in either the muscle or in the joint, and chronic inflammation of the muscle can lead to something called fibromyalgia, right?
Right.
And if it is in the joint, that can lead to something called osteoarthritis. Arthritis being inflammation of the joint, osteo, calcium being laid into the joint.
Yeah, I think of somebody pulling their back. You know, they pull it once and it seems like that just never goes away. That
never
pain,
goes away, because there may be an injury to a particular joint or muscle that winds up being a weakened area and an area of repetitive injury and stress and irritation.
So where does AZ Pain Centers fit in?
We treat chronic pain patients. Our specialty is spinal-related pain, neck pain, back pain, headaches, osteoarthritis, joint pain in the knee and shoulder. We treat osteoarthritis, fibromyalgia, headaches. Those are patients that we've developed a specialty treatment for their care and their intervention.
And you're talking about 90% of Americans, just those things you just mentioned. How many people have lower back pain or some sort of a neck pain?
Exactly. And we track our patients by using clinical outcomes. We use a clinical outcomes tool to track how they are improving with treatment intervention. We work collaboratively with their physicians or their physical therapists or their chiropractors or their athletic trainers, because we encourage our patients to be physically active, because our goal is not only just to relieve pain, but we want to improve their function and their quality of life and their well-being.
And you go to the source of where the pain is starting
Absolutely.
from.
Absolutely.
It's just a over-the-counter type of pill thing that fixes maybe the pain temporarily. You get to the source.
That's right. Well, you had mentioned about osteoarthritis, and as I shared with you earlier, that the joints wind up becoming irritated and calcium is put in the joint. Often those are pain generators. There's a medial branch nerve that comes from the spinal nerve and goes into the joint. If that joint is irritated, the nerve is irritated, muscles spasm, it diminishes flexibility, it diminishes function, quality of life. Patients wind up taking medications, and you have this whole cascade of events of taking a variety of medications, pain pills. What we've seen is our treatments will reduce the need for patients being on certain medications.
Very important. I know there are folks listening right now who go, yep, that's me. So if you want to put an end to chronic pain that you may be living with for years and you want more information, thank you for joining us and telling us about that, Dr. Kremer. We appreciate it. You can go to azpaincenters.com. That's their website, or call the number you see right there on your screen, 480-821-PAIN.